Imagine this. You're a 35-year-old teacher named Sarah. Over the past few months, something strange has been happening. Despite eating healthy and exercising, you've been gaining weight. But it's concentrated in unusual areas. Your face looks rounder, your abdomen is growing, but your arms and legs are staying thin. On top of that, you're constantly tired. Your skin bruises easily, and you've noticed a purplish stretch mark across your stomach. What's going on? These symptoms are classic signs of a condition known as Cushing Syndrome. But to understand it, let's dive into the root cause: hormones. Pathology. In your body, the adrenal glands, which sit on top of your kidneys, produce a hormone called cortisol. Cortisol plays a vital role. It helps your body respond to stress, regulate blood sugar, and maintain blood pressure. But what happens when there's too much cortisol? Cushing syndrome occurs when your body is exposed to high levels of cortisol over a long period. This can happen for several reasons. One common cause is the prolonged use of corticosteroid medications, like prednisone. Another cause is a tumor, either in the pituitary gland, called Cushing disease, or in the adrenal glands themselves. These tumors can overproduce cortisol or trigger the adrenal glands to go into overdrive. Signs and symptoms. Now let's go back to Sarah. Her round face, that's what we call moon face. Her weight gain and those purple stretch marks on her abdomen, they're due to fat redistribution and weakened skin caused by excess cortisol. And those skinny arms and legs, that's because cortisol causes muscle breakdown. But the symptoms don't stop there. She also feels weak, bruises easily, and her mood is all over the place. Thanks to cortisol affecting her muscles, blood vessels, and even her brain, some patients might even experience high blood pressure, diabetes, or osteoporosis. Diagnosis. When Sarah visits her doctor, they suspect Cushing syndrome based on her symptoms. But how do they confirm it? The first step is measuring cortisol levels in her body. This is done through tests like a 24-hour urine cortisol test, a late-night salivary cortisol test, or a dexamethasone suppression test, where cortisol production is measured after taking a steroid pill. Imaging studies like an MRI or CT scan may also be used to locate a tumor. Treatment options. Once Sarah's diagnosis is confirmed, the treatment depends on the cause. If her condition is due to long-term use of corticosteroids, her doctor will gradually reduce the dosage under careful supervision. But if a tumor is the culprit, whether in the pituitary or adrenal glands, surgery is usually the best option. If surgery is impossible or doesn't fully resolve the issue, medications like ketoconazole or metyrapone can be used to lower cortisol levels. Sarah might also need lifestyle changes like a healthy diet and weight-bearing exercises to combat osteoporosis and other effects of excess cortisol. With the right treatment, Sarah can get back to living her life. Cushing syndrome may seem overwhelming, but early diagnosis and proper care can make all the difference.